This is Common Ground, creating equity through public policy and community engagement.
Hi, and welcome to a very special edition of Common Ground. I'm Lynn Vaughn. Our subject is diabetes, specifically the rapid worldwide rise of diabetes, the increase in the number of people living with that disease, and the staggering cost associated with treating the disease prompted county health officials to organize the Diabetes Community Action Coalition of Fulton County. They have brought together the best and the brightest to wage a valiant battle against what is now the diabetes epidemic.
Information doesn't always equate to behavior change.
Nazira Dawood and Patricia Jackson of the Health Promotion Division and volunteer co-chair Vicki Carnes head up the coalition formed just this year. Members are waging a determined yet difficult battle to reverse the rising rate of diabetes.
Diabetes prevalence rate in Fulton County has increased from 4.3% to 9.3% over the last 7 years. Diabetes is an epidemic. It has actually doubled in the entire world in the last 10 years. In the last decade, it has doubled. So it's the same with USA, it's the same with Fulton County, it's the same with Georgia. So it looks like we have to give it more focus, just as we give for acute diseases.
The CDC projects a 74% increase in the prevalence rate by 2025 and 84% increase in the costs associated with the disease. It is imperative that we come together now and develop strategic plans to address diabetes in Fulton County.
In addition to ongoing educational campaigns, this coalition is working diligently toward what it calls PSE, Policy, Systemic, and Environmental Change. Here's an example. Community partner, the YMCA, has implemented a 16-session program geared toward those who are pre-diabetic. Vice President Kristen McEwen says the goals are to reduce their body weight by 7% and to have those persons exercise 150 minutes a week, the equivalent of 22 minutes a day.
Some folks don't even know that they are pre-diabetic. A lot of people just in the state of Georgia don't even know that they're diabetic. And there are so many things, and we're all trying to work together to educate individuals. But I'm honored to work for an organization that actually has a program that we can help folks before they go on to get diabetes.
Now, when we come back, members of the Diabetes Community Action Coalition of Fulton County, that's Nazira Dawood, Program Manager of the Health Promotion Division of Fulton County Health Services, and her guests will examine the dimensions of the problem and explain how the coalition is addressing the diabetes epidemic. You are watching Common Ground on FGTV. Our panel members begin their discussion after a short break.
Welcome back to Common Ground. I'm Nazira Dawood, Health Promotion Program Manager at Fulton County Health Services. Joining me to talk about the diabetes epidemic are Patricia Jackson of the Health Promotion Division, Vicki Carnes, registered nurse and diabetes educator and chair of the Diabetes Community Coalition of Fulton County, and Dale Benzine, president and CEO of ProMed and steering committee chair of the Diabetes Community Action Coalition of Fulton County. Thank you for being here.
Yes.
Vicki.
Yes.
Diabetes, one of the top leading causes of death in USA,
Yes.
in the world, in Georgia, in Fulton County, also called the sugar disease. How do you explain what is diabetes in layman's term to our viewers?
Well, what's important to understand is that the most common type of diabetes is what we call type 2 diabetes. And type 2 diabetes is a condition where the blood glucose or blood sugar levels are higher than normal. And it doesn't just show up overnight. Oftentimes people will have a condition of higher than normal blood sugar for a period of years, and that is particularly is called prediabetes. And at that point, a healthy lifestyle can prevent or delay the type 2 diabetes.
So let me ask you this question. What is the normal blood sugar level? And what is the higher that's called for diabetes?
Well, normally we see a blood sugar level in the morning of less than 100. Okay? And when blood sugar levels are high, I have a little prop here. This is let's say the blood in your blood vessels. It's quite fluid, but when the blood sugar levels are high, it's almost as if the blood becomes thick. All right, and actually the little red blood cells that are circulating in our arteries and veins, this is an example of one that has actually become saturated with sugar. So this is uncontrolled diabetes. The red blood cells are saturated with sugar. A normal red blood cell would look like this. Very little sugar that's stuck to the cell. But diabetes under control is never quite normal, but this will prevent the complications, having the blood sugar under control, blood pressure under control, blood cholesterol under control, and most importantly, not smoking.
So this patient goes to the doctor and the doctor says, I see red blood cells, I see white blood cells, and he says, I see donut cells.
Okay. What?
So Dale, Vicky did say that there are type 2 diabetes. So tell me, there are other types of diabetes, and what are they about?
There's really just two types, and the type 1 diabetes is, or sometimes referred to as juvenile diabetes, is more genetic in nature, and it's much infrequent. The type 2 diabetes that Vicky described is much more prevalent in America today, and it leads many times to lifestyle, to what we are, what our daily activities, what we eat, our activities, and what we're doing, and so forth. And so when we're dealing with type 2 diabetes, like myself, which I'm a type 2 diabetic. I was diagnosed 5 years ago. And you learn through your different habits, your lifestyle. When you're originally diagnosed, you're very encouraged, especially in a pre-diabetic stage, to keep a diary of what you eat, what you do, what happens. And then what happens, you go to the diabetic educator, such as Vicky, and they help you and they assist you to get your blood sugar, what they say, under control. And currently, I test twice a day. I test for my blood sugar twice a day. It's under control through medication, through activity, and I'm hoping that we keep it that way.
So is there something also called gestational diabetes, and can Vicky talk about it a little bit more?
Yes, gestational diabetes is high blood sugar that occurs while a woman is pregnant. About halfway through the pregnancy, it's not uncommon for women to have higher than normal blood sugar. And at that point, it is so important to get the blood sugar under control because high blood sugar can cause complications in the pregnancy.
Okay. So not all of the people know they have diabetes. There's something called pre-diabetes.
Well, what's so important is that of every 3 people that have diabetes, 1 is walking around and doesn't know it. And that's scary because when they have diabetes and don't know it, many people don't have any symptoms. So they need to visit a healthcare provider to be diagnosed. But like I said before, it doesn't happen, diabetes doesn't occur overnight. So there is a period of perhaps 4 or 5 years when blood sugar is higher than normal. And that's when healthy eating and physical activity, no smoking, can turn the tide and prevent diabetes.
I think it's important to point out, pre-diabetes, 95% of the people today that are diagnosed with pre-diabetes move on to full-fledged diabetes. It's I think what happens is we don't put enough emphasis in the pre-diabetes stage because it's very easy to go from pre-diabetic to a diabetic stage. It's almost like a snowball moving downhill, and once that snowball picks up speed and it starts going, you can move into that stage at a very, very rapid rate. And when people hear that they have pre-diabetes and it's not diabetes, they still think, well, I still have time. Well, you really don't have time. As my doctor told me 5 years ago, you really don't know how bad you feel because you don't remember when you felt good. Once I got it under control, once I got my blood sugar under control, my blood pressure under control, my cholesterol under control, and hopefully my weight under control sooner versus later, it's the type of situation that you combine that with a good night's sleep, and you basically get your life back, and we move on from there.
So diabetes is very well known as a silent epidemic. India has the #1 prevalence rate in diabetes. Second is China, third is US. A recent study showed that Georgia falls under the diabetes belt just because diabetes prevalence rate has increased in Georgia, obesity rate has increased in Georgia, obesity in childhood obesity stands #2 in Georgia across the nation. Can Pat give me some statistics in Fulton County? What's the prevalence rate of diabetes in Fulton County?
Sure. Over the last 7 years, diabetes has doubled in Fulton County. There's right now, per CDC statistics, a 9.1 prevalence rate. CDC anticipates that by 2025, diabetes will have increased by 71% in the Fulton County or Atlanta metropolitan area, and costs associated with the disease will increase by 84%. Those are tremendous numbers.
Dale, give me some reasons why this prevalence increased. So with what Pat is telling me, diabetes has gone from 4% to 9% over the last 6 years in Fulton County alone. What are some of the causes of this huge increase in these?
Lifestyle. Lifestyle. It's just lifestyle. And when you get more sedentary, when you sit around more, if you're not have an active lifestyle, if your diet, is the fast food chains versus, the fruits and vegetables, it just happens, and it's happening at an earlier and earlier age. Instead of going out and playing at a younger age, the children today are playing with the video games and sitting around, and just exercising your fingers isn't enough. And you combine that with the different high sugar drinks, the high sugar and carbohydrate foods that get consumed, it just leads to this. And we're finding at a younger and younger age that we need to be tested. We need to be tested as a norm versus an exception. Years ago, it wasn't even heard of to be tested with an A1C, and Vicky can go more into an A1C score, but to not get tested until at a later age or until you are physically, the doctor sees you and says, I think you have diabetes. But today, as we discuss, it's as important to know your diabetes score as it is your blood pressure, as your weight, as your cholesterol, because what happens is the sooner you know your baseline, at 18 years old, 30 years old, 35, the sooner you know your baseline of your diabetic score, the better, because then you know how to correct it.
So, Vicky, just a quick answer. Is this a myth or a fact? People with a history of diabetes, type 2 diabetes, always end up with the type 2 diabetes?
A family history is
Yes.
Is definitely a risk factor. So if your mother, your father, your brother or sister have had diabetes, you're at risk.
Let's take a break now. We'll continue our discussion on the topic of the diabetes epidemic in just a moment. Welcome back to this special edition of Common Ground. I'm Nazira Dawood. My guests and I are talking about the unprecedented increase in the incidence of diabetes in our county and country here in Fulton County. Vicki, so tell me the symptoms of diabetes. Even though it's a silent epidemic, how does a person know they're diabetic and what are the symptoms that come out?
Well, the most important way to find out is to see a healthcare provider and be checked, because so many people don't have the classic symptoms until their blood sugar is so out of control. And the common symptoms would be an increased thirst, increased urination, increased hunger, blurred vision, weight loss, fatigue, cuts that do not heal. But it's so important to get checked, especially because what many people don't realize is that the condition we talked about of prediabetes, it does not cause complications like vision loss. But in the stage where a person is prediabetes, I have this little risk for heart disease and stroke is there. So you don't want to ignore the condition that's between normal and diabetes. The condition we call prediabetes is puts you at risk for heart disease and stroke.
Okay. And what are the complications of diabetes, Dale?
Oh, where do I start? Yeah, it's again in a company, in my company at ProMed, we deal with over 10,000 patients, and as Vicki was saying earlier, it's most of the time when people finally decide there's something wrong, they have blood sugar scores in excess of 200, 300, 350, which means emergency room basis. And what we're trying to strive for is when you see these early complications, frequent urination more than normal, the blurred vision, so forth, get to the doctor. Get to the doctor. Get tested, and so that the doctor can then present treatment plans. Sometimes it's oral medication, sometimes it's insulin medication. But it is so important to get your blood sugar under control right now.
Right.
Not tomorrow, not the next, but right now. Because if you don't do it, it will lead to, you don't really die directly from diabetes. I think that's a common misconception. You die from heart disease. You die from congestive heart failure. You die from these other complications. But test after test, study after study has shown that you're 50, 60, 70, 80% more apt to have these kind of complications with high blood sugar in a diabetes situation. And I just can't emphasize enough that it's something that has to be addressed right now.
So it's so ironic that diabetes is called a sugar disease. I usually call it a sour disease because it causes complications from our head to our toe. For example, our eyes, it causes blindness. Is it true that diabetes, the blindness is number one leading cause for one of the diabetes complication?
Well, it is true that for adults, the leading cause of blindness is uncontrolled diabetes. So that's what's so important about the complications, is that our viewers understand that it's diabetes that's uncontrolled. And part of control, we call it the ABCs, that your average blood sugar is under control, blood pressure is under control, and cholesterol. And the only way you know what's under control is to work with a healthcare provider. And actually, there's more than just it's a diabetes care team, which involves an eye doctor, a pharmacist, an educator, hopefully, it's just the idea that with a chronic condition, most people have to adjust to the way of thinking that it's up to me to care for myself. It's a self-care condition.
Okay. And then we have the heart disease, heart attacks, cause of diabetes complications or uncontrolled sugar level.
Yes.
We have the kidney problems.
Yes.
So you showed me an interesting map earlier that showed the dialysis centers are just popping up in Fulton County.
Well, a person with uncontrolled diabetes or they don't know that they have diabetes. Okay, it's common that the high blood sugar level, it's almost as if you had sand in your gas tank. No one would want sand in their gas tank. Everyone knows it's caustic, it's toxic. So, but high blood sugar level is toxic to the eyes, to the kidneys. And I see here there's 32 dialysis centers now in Fulton County. So that's very costly. And for people that don't have insurance, what's so important to know is that there are healthcare providers in the Fulton County area that are there to serve you. Okay? The Fulton County Health Department has 2 health centers where primary care services are offered. The Grady Health System has primary care services. Also what we call the community health centers like West End, Palmetto, Southside, and St. Joseph's Mercy Care, primary care. And then there are the free clinics in the metro area. So help is there. And for people that don't have insurance, this was just recently released in August, the Atlanta Regional Health Guide, Resources for the Uninsured. And this is available to anyone in the metro area.
How can they get hold of that?
Well, there is a phone number. It can be picked up at quite a few Fulton County offices, but there's also a 1-800 number that a person could call and order 200 copies to share, and that number is 1-888-720-1337.
Since we're talking about the complications, amputation seemed to be a complication itself for diabetes. And it's interesting that I read recently, it said people having amputations per year in U.S. are actually more than the amputations that were performed during the Vietnam War.
Oh my goodness.
So,
goodness.
Dale, do you have anything else to add to the complications?
I just need to second what Vicki was saying a little bit about the cost. The true cost of diabetes doesn't get to be expensive until it's advanced. For most third-party insurance companies, including Medicare, including Medicaid, they highly encourage testing of your blood sugar. It's very inexpensive. It's less than $1 a day in most cases, and medical suppliers such as mine, ProMed, will be glad to walk any person through the maze of the paperwork to get reimbursed, from the standpoint. And the other point I need to make is, a lot of times people, when they start their treatment plans and they're presented with oral medication, they feel it's a magic pill. Let's get something straight right now. In diabetes, there is no magic pill. There is no magic pill. What the pill does is reduces your insulin levels down to like 30% and brings it down to a controllable. So if you have a blood sugar level, say, of 180, and you needed to get it down to 120 or 110, the pill will bring it down about 30%, and help control that. But over time, that too will wear off, right. And that's what happens. That's what happens with the cost. And it leads to injections, further injections, and more complications. And like you said, amputations. Amputations lead to very expensive medical costs, and now you're talking big-time problems.
So is it true that we are spending $174 billion per year in U.S. for diabetes
direct and indirect costs? Yes. But I just want to stress again that there's no need to think about amputations if you're taking care of yourself. The risk for amputation is a combination of 3 things: poor blood flow to the feet caused by blood vessel disease. The immune system doesn't work as well when they have high blood sugar. And the third is that oftentimes people can't feel their feet, so they don't know when they have an injury. But if you get an infection, you must have it treated. If the infection goes to the bone, that's serious, and that's avoidable.
It's interesting that you said the magic pill. People just want the magic pill. A recent study that's called the SHIELD study, which did a survey for 200,000 household members in U.S., said people know diabetes. They know the complications of diabetes. People are very well aware They just said, give me the magic pill. So when we come back, we'll probably talk about okay, so they're aware. We've done our part in educating them. What is the next step? That's all time we have for now. My thanks to Pat Jackson, Vicky Carnes, and Bale Denzine for sharing this important information with us. This is part one of two-part discussion on this subject. We'll have more in a future report. Coming up after a break, the numbers to call if you want to join the coalition or if you'd like to find out more about the disease of diabetes. We'll be right back.
And let me add my thanks to all of our guests for their time and their very hard work on this issue. And here's the contact information Nazira promised. To join the Diabetes Community Action Coalition of Fulton County or to work with the coalition, call Health Promotion at 404-730-1243. And you can call or visit the Fulton County Health Clinic nearest you to find out if you are diabetic or even pre-diabetic. Call the main number, 404-612-1211. That is it for this very special edition of our show. Thank you so much for being with us. I'm Lynn Vaughn. We will see you next time right here on Common Ground.